So just start off. So what career do you have currently right now?
Right now, I teach full-time here, but I'm a physical therapist, so I see patients outside of CBU.
Yeah, gotcha. And then what made you want to become a PT? And more specifically, like working with students and other people that you work with as a physical therapist?
I wasn't totally sure what I wanted to do with my life at a younger age, and I had a family member that was a physical therapist, and talking to him kind of piqued my interest. And so I was able to go up and spend some time with him in high school and kind of see what the field of physical therapy was about, and decided to pursue it in college.
Okay, gotcha. Let's see. What have been like some key experiences, like job experiences or education experiences that prepared you for your career as a physical therapist?
I myself hadn't been a physical therapist growing up, but I had friends playing sports and being active that were injured, went through the process, was even able to accompany them a couple times like to their treatments and see what it was all about. So that was good for me to see the field as a whole. And then being around sports, I had heard about physical therapists and saw how they interacted with the athletes and the high-level performance institutes and things like that. So that's what piqued my interest in it, got me into it. Once I was in school, it's all about finding a mentor that's willing to invest in you and put that time into you. And I was really lucky to have a couple that really brought me along and helped me grow in the field and as a person as I was coming into physical therapy.
Yeah. Okay. Yeah, and that's the same for me as sports. That's what kind of brought me into like the whole PT profession. Just watching like with injuries and the rehabilitation process, and then all that stuff and stuff it helps with. What would be your personal philosophy that you kind of evolved your career around, and like how has that affected your professional practice?
Being a Christian, it's working in service to others, even sometimes when you feel like they don't deserve it or don't need it. And so trying to replicate that not only in academia but even with your patients, making it bigger than yourself and doing it as a service to them is a way to spread the gospel. And so trying to implement that on a daily basis, even if you're not having a conversation about Jesus, but just showing them the heart of Jesus through your interactions with them is something that I think is super important to try and display on a day-to-day basis, both in academia and in the clinic.
Okay, yeah, that's good. And would you say there's sort of like a psychology aspect to your career as a physical therapist, like sport and exercise psychology? So like the rehabilitation process, how can have people get in like the mood of like depression or just like in a sad state, where like they need help or motivation.
Yeah, and there's gonna be a psychological component in every setting. It's just different from person to person versus your high-level athlete that may be depressed about the injury, or working through some things mentally, versus the patient that you see an outpatient that's just worried about the cost of it. There's going to be a psychology that comes with that, in the expectations of do they believe they're going to get better. And so while you don't get a ton of that in physical therapy school, I think it's super important, especially in your undergraduate when you're required to take general psych and abnormal psych and things like that, to understand the mindset behind it and why it's important to get people to buy in, or at least be empathetic to their own personal situation of why they're in therapy and how they feel about therapy, and do they believe in therapy, do they think it's going to work. Trying to access that part of it is really important. Harder in the outpatient realm. In the inpatient realm, you have access to other disciplines that can help you in that, and trying to bring that whole collaborative care into it is super important for getting the person back to where they want to be.
Okay. So like what would be like some examples or techniques that you use to like for my internship right now, it's at an outpatient clinic and it's a lot of elderly people. And they have some of the elderly, they feel like the therapy is not necessary because they're 85 years old, 90 years old. That's like what I need to exercise for. So like one technique they use is because so there's like an elderly lady, she's giving the therapist a hard time, so they like kind of use me as like a cute charming kid, so like they get them like motivated to like do some exercise in front of them.
And you have to relate it back to the patient too. So if I start talking to a gentleman that's in his 70s, about why this exercise is going to make his infraspinatus strong, he's not going to care necessarily, right? But if I can relate it back to the goals that we've talked about on day one of no, this muscle is important because this is what's going to load in your backswing for your golf game, and he's a big time golfer. Now I have buy-in.
Yeah, you gotta apply it to their daily life.
Yeah, you have to apply it to the goals that you've set out on day one. Well, why are you here? Like, what do you want from me? Not just to get your shoulder less painful, but what are you having problems with doing? Like, what do you want to do? What's going to be our markers that are showing improvement? Yeah. And so then with every intervention that you do with them, exercise, relating it back to that to motivate them. Well, this is going to help you because of this, right? It may be making his infraspinatus stronger, right? But if it's really starting to eccentrically deload it through, transition of backswing to foreswing follow through, he's going to want to know that part of it, and that will get him motivated. Yeah. So it's just with each individual patient finding what makes them tick, what makes them motivated to get better.
Yeah, you don't want to push them either, right?
Right.
Like, say like someone just got out of surgery and stuff, and they're in a lot of pain, and like don't want to be like, all right, get up, get out of bed. It's not good. Like, try to push them.
Depends.
Yeah.
Depends on the person.
Just depends.
Early mobilization is the best. You just have to understand if they don't want to get out of bed, why.
Yeah.
Right? And is it reasonable? And if it's not, find a way to motivate them to get up. Right? Yeah. Are they scared of pain, and that's why they don't want to move? Okay. Well, you're gonna have to get over that at some point, right? Yeah. Maybe it doesn't have to be today, but laying here is not going to decrease the pain necessarily. And so figuring out the avenue of attacking it the best and explaining it to them in a way that they understand is really the most important component.
Like what I kind of observed too is some therapists will try to say if the patient doesn't want to do any therapy, they'll start off small. Like, well, let's just see if you can get out of bed or something like that. Yeah. And then they get out of bed and it's like, okay, let's see if you can walk to the door.
Yeah.
And so it's like slow steps.
Yeah, it's the same thing we do with kids in pediatric therapy, right? Yeah. If I tell them, hey, you're going to do physical therapy right now, they're not going to want to do it. Yeah. But if I have 8 games that are therapeutic in essence, but they think they're just playing a game, they're going to be way more motivated to do it. So it's all in the way that you phrase what you're doing to the patient.
How you present it.
Exactly.
Okay. Exactly. So in your opinion, what would you think is the greatest ethical issue that in like the medical professional field? Like for instance, one that I can come up with would be like, say, not equal care or something, just because of like insurance companies and HMOs and paying for treatment and stuff like that. What would you think is the most?
Right now, it's keeping established disciplines kind of in their lane. Because of reimbursements going down, we have more and more fields that are trying to expand what they're able to do. Yeah. They're essentially taking something that another field may do really good and just kind of rebranding it in their own terminology to make it that and try and get more reimbursement out of it.
Okay. Like kind of like overlapping.
But calling it something different, right? And that becomes a problem because reimbursement's going down with insurance companies and stuff like that. So people are always trying to make sure they can thrive and survive. And so oftentimes, though, it makes it a little bit iffy when it comes to are they properly trained in these new things that they're going to do and be implementing. If they're properly trained in it, I have no issue with it. But it's sometimes they will kind of create this new thing that they're going to perform when really they may not have the adequate training to be doing it. There may be someone that's better equipped to do it, and yet we're putting the patient in iffy scenarios just so we can get a little bit more reimbursement out of it.
Okay, yeah, that's a good one. What do you find most rewarding in your career as a physical therapist?
Anytime you have someone that just gets that like big, wide-eyed look of success when either they haven't been able to do something in a long time or their pain level hasn't been this low in forever. Those are the highs that kind of make it all worth it.
The progression.
Yeah. Not just when you see it, but when they get excited about something, for sure. That's the biggest reward.
That's